Stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by.
Good morning. Welcome to today's meeting of the Health Committee. Members of the public may like to follow at London Assembly on the social media and use the hashtag AssemblyHealth for this meeting. Please may I remind participants to silence their devices. The main item on the agenda today is the health impacts of gambling in London. However, we have a few short items of business before we proceed with that meeting. Can I ask the clerk, Diana Richards, to confirm any apologies for today's meeting?
Thank you, Chair. No apologies for absence have been received today.
Okay, thank you. Can we note the list of offices held by Assembly members? Can I also ask Assembly members if they have any disclosable pecuniary interests in any specific items listed on today's agenda? And I'll take a silence as being no. Can we confirm the minutes of the meeting held on the 29th of November 2023? Thank you. Can we note the completed and outstanding actions arising from the previous meetings? Thank you. Can we note the action taken by me as chair under delegated authority in consultation with party group leads, namely to agree the committee's letter to the Mayor of London on trauma-informed approaches to youth violence? Thank you. That brings us to today's main item. I'd like to extend a warm welcome to our panel of guests joining us to discuss the health impacts of gambling in London. And I'm going to ask the guests to introduce themselves, and I'll start off with you, Colin.
Thank you. Hi, everybody. I'm Colin Walsh. I've got my own experience of gambling harm and recovery, and I'm also lived experience manager at GamCare, who deliver support and treatment across the Greater London area and operate the National Gambling Helpline.
Thank you. And Tracy?
Hi, my name's Tracy and I'm an affected other. I support other women like myself through peer support with GamFam, as well as affected others that have been impacted by crime through GamLearn, and I also work with women with Thriving Together, which is a space for women run by women impacted by gambling harm.
Thank you. And Dean?
Yep, my name's Dean Frost, a London cab driver by trade, recovering compulsive gambler. I haven't had a bet for 7.5 years. I'm a regular attendee of Gamblers Anonymous and also work for a charity called GamFam. We provide support and help for people that are struggling with gambling. That includes the gambler and it includes the affected others, i.e. mums, dads, husbands and wives. And currently we run about 18 meetings a week and hopefully growing. Mm-hmm. And yeah, we provide support and hopefully help people overcome their addiction.
Thank you. And Tom?
Hi, my name's Tom. I've got my own lived experience of gambling harm as well, and I'm also the comms manager for a charity called Gambling with Lives that was set up by families bereaved by gambling-related suicide, and we now support families bereaved by gambling-related suicide. Thank you.
Great. Thank you. Look, thank you to all of you guests coming along and contributing to our investigation. Each of assembly members will have a lead of questions, and other assembly members will come in if something comes to their mind or they want some clarification. So it's just more of like a conversation. We want to get knowledge from you and learn from your experiences and your experiences of the people you're helping to overcome the gambling addiction. I'll start off. So can you please tell us about your own experiences of gambling harms and how this impacted on you and those close to you? Any one of you can start.
I'm happy to go first.
Okay, Tom. Thank you.
My experience of gambling harm was direct, so it was my own experiences of gambling. It was always through football. I think I was probably 17 when I placed my first bet, but it wasn't a case for me of sort of instant addiction, and I didn't really see it as a problem then. The problem really probably started in my sort of mid to early 20s, I would say. I'd recently moved to London, actually, and I was on quite a low-paid job, so I was spending a lot of time at home, and I was thinking about ways that I could potentially make money. So I was watching a lot of football. I've always been a really avid football fan, still am. And there's obviously a lot of gambling advertising in football, sponsorship on the shirts around the stadiums, adverts at half-time and things like that. So I sort of started to think that it would be a reasonable way to supplement my income, because I didn't have a great deal of money to go out. So, friends and things were going out on weekends, and I was probably spending a lot of time at home. There's probably 5 to 6 televised games of football on at the weekend. So it definitely started. Money was the sort of motivation for starting, but it ended up taking so much more from me. And over a period of about 2.5 years, it just intensified. Things sort of started to fall apart in other areas of my life, work, friendships, relationships. And it took me to a really, really bad place, to the point where I just couldn't stop. And I'm quite a sort of well-rounded, I would say, sensible individual. I'm not vulnerable in any sense of the word, I would say. I've not had addiction issues in the past, but I just couldn't stop this. And I remember feeling terrible because of all the sort of messages and things that you see out there on the adverts about when the fun stops, stop, or take time to think. So I thought, why me? Like, why am I this only person that I can't stop everybody else? Is, everyone else having a great time, and they can control it, but I can't. So it really took me to a really bad place mentally. I didn't lose a huge amount of money. I actually don't know, but it was definitely not life-changing. It was probably under £10,000, so enough to be able to pay off, and it was on credit cards at the time. But the damage it did to me was really to my mental health. As I said, it just took me to a really sort of dark and miserable place, to be honest, because I blamed myself because I couldn't stop, and I didn't realise that the gambling is a really addictive thing, and there's a lot of things that the gambling industry do that sort of get you addicted and keep you addicted. I didn't realise all that at the time. I do now. But yeah, so I just couldn't stop. I tried. I went to see a doctor, actually. They diagnosed me with depression, which I think now came about as a result of the gambling, but they saw it the other way around. They saw it as I was anxious and depressed, so I took to gambling as a means to escape that. But I've never been anxious or depressed before that or since that. And it took me to a really bad place. Fortunately, my sort of rock bottom was at, I'd say it was bad, and it was bad, but there's up to 496 gambling-related suicides a year, so thankfully it didn't take me there, but it did take me to a really bad place. Thankfully, I was able to stop in the end. I used a tool called GamStop, which is a sort of overarching self-exclusion tool. You can self-exclude with individual operators, but because there are so many of them, I would go through a sort of process of after a weekend of gambling, basically feeling awful on a Sunday night and thinking I'm never going to do this again. So okay, I'm going to block myself with one, and then sort of Tuesday, Wednesday comes about, and it's like, okay, I'm going to open an account with this other one, and I'm not blocked with that. But then I found GamStop, which is a tool that just applies to all licensed gambling operators in the UK. And I had a bit of therapy at the time that wasn't gambling related, but that was a sort of good place to discuss it. As I said, the GP wasn't much help, but yeah, I was able to stop and sustain my recovery since then. And here I am today.
Well, first of all, Tom, look, thank you very much for that very powerful personal testimony. And I just want to say to any listeners who are listening that we may be discussing topics of suicide, okay? But if anyone finds any topics triggering, then help is available 24 hours through agencies like the Samaritans. I just want to highlight this to any listeners who are listening. Tom, I just want to know, you obviously, what made you take you to GP? Was it yourself taking yourself to GP, or was it your members of your family, right, intervening and encouraging you to do so? What was the trigger for you to go to your GP?
It was myself. Members of my family and friends and my partner at the time didn't know that I was gambling to the extent that I was. I think, people knew that I would, like a bet. A bit of a cliched phrase, but yeah, they didn't know the extent. And you see, just going back to the advertising, you see, it's always like a fun social activity. But for me, it was, sitting in the toilet at work and doing it, or it wasn't nice. It wasn't fun. So, yeah. So I went to the doctor essentially because I wasn't sleeping. I felt really depressed. I did have sort of fleeting thoughts about suicide and things like that. So yeah, I thought it was the best course of action to go and see a doctor and see if there was anything they could do for me.
So I mean, that's very useful. I mean, is that you had insight into that something was wrong, right, in your own self, that you needed to get help, and you sought the help. So that was an important thing, of you having insight into your own issues. Thank you for your. I was going to get an opportunity to speak to other guests. Dean.
Yeah. Just please pause me, because I can talk about gambling, recovery and addiction for ages. It's the only thing I know. If someone asked me to come and talk for 3 or 4 hours about addiction, gambling addiction, the power of addiction and recovery, I could talk about it for hours. So please pause me and stop me if I go on for too long. I started gambling when I was a kid, not compulsively, but I was more attracted to the fruit machines as a young boy. Brought up in caravan sites and sort of holiday homes at the weekends. So other kids would go off to play computer games. I'd be attracted to fruit machines. It probably should have been a warning then. But my gambling really took off about a year before I became a London cab driver. I had a big win. I had a win on a horse called the Touch of Frost. It won at 33-1 for a fiver. And I'm thinking, when I become a cab driver, I'm going to take these betting shops to the cleaners, and I can make this a career. How wrong did I get that? 2 years into being a cab driver, I was in and out of betting shops all day long, every day. So I was robbing Peter to pay Paul, taking loans out, lying to my partner, lying to my mum and dad, lying to friends. If friends were asking me to come out the weekend, especially when I was in my 20s, when maybe I was full of life, do you want to come out? I'd say I'll be out, and come Saturday I wouldn't be out. I'd have no money. I'd be in the cab working to try and fund and finance my gambling. So my gambling was all done in betting shops, horses and dogs, maybe occasionally football. I didn't really enjoy football betting because it took too long for me to get the result. I wanted a result within 5 minutes or 2 or 3 minutes. But I do understand, I can see now the power of football betting today, because it's in play. The way that they've designed it to suck people in to be involved in the game in that very moment, rather than back in 20 years ago, you'd have a bet on a football game. You could only find out whether you won or lost at the very end. Today, the gambling companies through the phone are pulling people in to play in play. But thankfully, I stopped 7 years ago. I didn't get involved in downloading anything on my phone. I never done really any online gambling. Mine was done in betting shops. But the space I work in today is, say, for a charity called GamFam. I did a poll last night, and 14 out of 15 it was all online betting. So we're seeing the change. It's not. And as a London cab driver, I drive around London. I'm actually seeing betting shops close, but that doesn't mean it's a good thing. It just means that everything's gone online. The only thing I have seen an increase is in the slot machine arcades that are open 24/7. They have started to increase in London, but betting shops not. But as I say, I think I'll finish on this. I can talk forever. I've just sat on the DLR. I've just sat on the Elizabeth line from where I've lived. I sat in a compartment. 8 out of 10 people in my compartment were on their phone. The next, I got on DLR, and I looked at the next 8 people. 6 out of 8 were on their phone. I'm not saying everyone's gambling, but there's a problem with the enticement of commercialism, advertising, gambling, shopping. You know, no one's putting cash over the counter anymore, and I think that's what we're seeing is an increase in gambling because of the phone. I don't have to go to a casino, don't have to go to a betting shop. I mean, I'm meeting people along the way that are laying under their covers and gambling. Don't even get out the house. They don't even have to walk down the street to place a bet. But I'm talking about others now. So yeah, I've stopped for 7 years. I lied to my wife. When I used to walk indoors, my wife would go to me, "How's your day been?" I used to think, if only you knew. You know, I've been at a betting shop for 8 hours, 10 hours. How's your day been? So the devastation, I probably still feel it now. There's still a disconnect from me and my partner, or she occasionally remind me. We are on a better path now. We've got a good relationship. We have a bit of banter and a bit of laugh about it. But yeah, I think every day I gambled was a millimetre away from my wife. So if I gambled for 10 days, 20 days, that gap between me and my wife got greater, and recovery hopefully brings us back. And so the devastation is relationships, finances, numb, don't even feel. I think a big part of, I was talking on a meeting last night, big reason for people struggle in recovery is dealing with feelings and emotions. So once the gambling maybe takes us away. So I'll finish on this. I think many people want attachment. I wanted attachment to gambling. It probably took me away from everyday life, living life on life terms. Today I've learned to live with life on life terms and face what comes along. But there's no doubt the advertising and the power of the industry is probably luring a lot of people back in when they want to remove themselves. It's too powerful. It's devastating. And I I enjoy working in the space I work in. I work with people at they're at wit's end. Mm-hmm. But clearly, obviously, needs to be more awareness, more education. But I do enjoy what I do, actually working with people. But you know, it's devastating because I mean, last night, people losing their jobs, in trouble with the law. I took a meeting last night. I see the devastation of the end result of where gambling can take people, and the very end is suicide. With that, I've rambled on too long.
Not at all.
I call it Ramblers Anonymous. That's what we call it. Gamblers Anonymous, Ramblers Anonymous.
Look, thank you very much, Dean, for sharing your story. You said, if I got it correct, that it was about 7 years ago that you addressed your problems. Was it you going to seek help yourself, or was it some member of the family or who prompted you?
So just to let you know, from 2000 to 2017, I struggled on and off. So I went to lots of meetings, and when I went to meetings, I stopped gambling. When I stopped going to my GA meetings, I went back gambling. So it shows that I need to maintain my recovery. This time round, my wife, I went indoors after being out of work in the cab for 2 hours. I walked back indoors, and she said, what are you doing back already? You only left for work 2 hours ago. And she saw in my face, and she said, you've been gambling again. And so it's really, I went back of my own accord, but really my wife pushed me and said, basically, if you don't go back to meetings or go and get some support or help, counselling, therapy, this relationship's finished. And so a combination of I did want to stop, but a prompt of, you know, this relationship's over if you don't take action. So yeah, a bit of both.
Great. Some of the themes you raised, we'll explore them in a bit more detail. It's not that we've dropped them. Okay, we'll pick them up. Okay, later on, my colleagues will pick up. But Tracy.
Hi everyone. So obviously my journey is slightly different because I am an affected other. So I've been an affected other all my life. From substance misuse, I lost my sister to heroin addiction 6 years ago. My partner has been a gambling addict for 36 years. He's only been in recovery for 2.5, I believe. So as an affected other, life is very isolating. There is a lot of stigma and shame attached to being with an addict, living with an addict. And so you are judged by everyone around you, even the people that love you, your friends, your family. You begin to feel quite ostracised. And as a woman particularly, and I support just women, so I'm not hating on men, I'm just literally can only go from my own experience. You know, I hear the same stories over and over of women suffering in silence for years. I was that person. And often women don't reach out for help until they reach a crisis point. My own journey has been one of mental health issues. My mental health suffered massively. I isolated myself. I stopped talking to friends about what was going on in my life because it was just, you know, they cared, but there was very much sort of, well, why don't you just leave? Well, where am I going? With what money? Because as you're probably aware, gambling addiction is a money-orientated addiction. You know, you could give a gambler £50,000 and they could do that in a day. If you gave a heroin addict £50,000 and said, you need to take £50,000 worth of heroin today, that person's going to die. So there's the difference. So where am I going? Because there was nowhere to go. So I found myself very isolated and alone. I couldn't reach out to anyone. I was afraid I would lose my children. It affected my job. I eventually went to my GP and I left with antidepressants, which were not particularly helpful. 6 months later, I went back and I was given antipsychotics for PTSD. And was told, I don't know anything about gambling addiction. If it was a substance misuse, I'd probably be able to help you. I support lots of women and I hear these stories every single day. I supported a lady just a couple of weeks ago who, after 18 months of coming to groups and understanding gambling harm and wanting to help her marriage and support her husband moving forward, finally went to the GP for some help and came away with contraceptive pills. She was told, now's probably not a good time to have a baby when you live with an addict. So that's what us women are up against. Women in this space are stigmatised. There is that, why are you with an addict? Think about your children. I talk a lot about domestic abuse and people are quite shocked about that, but domestic abuse and violence is growing amongst affected others and gambling harm. I would say probably a third of the women that I support are experiencing some form of domestic abuse, coercive abuse, emotional, psychological abuse, and of course financial abuse, and in a lot of cases neglect, because there's no money, there's no food. You know, they're experiencing food poverty, fuel poverty, you know, the list goes on. As I said before, I generally find that, and myself included, I didn't reach out until I had a crisis, and that crisis was that my partner committed a crime due to his gambling. So there I was again, you know, on my own, one wage coming in, trying to juggle everything. The pressures of that are huge. As an affected other, we become, you know, everything. we become a housekeeper, we become the earner, we become an accountant, because as many on the panel will tell you, one of the first things is, take control of the finances, reduce, the chances of them gambling and relapsing. You're holding that space constantly. This is all on women's shoulders. And there needs to be more understanding and support for women affected by gambling harm. My partner is 14 months bet-free, the longest period of his life. And I don't take anything for granted each day as it comes. But there are strategies in place that we work through together. And I hope that through supporting some women, and, my journey is their journey. I'm no different just because I'm in a position of offering that support. I'm also working alongside GamLearn, who offer support for those affected by committed a crime due to their gambling, and I support affected others in that journey. It's isolating, and people need to wake up, because mental health crisis, women literally, I'm speaking to people that, have had no heating for a week or can't afford to feed their children, and I'm trying to get, in contact with, food banks and things. Again, social housing. Currently, social housing doesn't see gambling harm as a domestic abuse issue. It's not prioritised. If I've been told myself, if it was a substance misuse, we could help you. Gambling, sorry, don't know. So yeah, that's just the beginning of the journey, but I really hope that people in this space, because once again, I am the only woman here in quite a male-dominated space, and from my own experience, affected others is very much an afterthought. And I understand that the gambler is important, that they need treatment and recovery, but without us, often that doesn't happen because we're the ones holding it together. So, I think there needs to be more focus on us and our journeys and the part that we play. And there needs to be, more help out there for women, by women. And that is received properly and supported properly. And ask us what that looks like. Don't just create a space and go, there you go. As my very learned friend Faye once said, women are not just small men. So, thank you.
Thank you, Tracy, for again sharing the very powerful personal experiences and how it's impacted upon you. In my other life, I am a GP, and therefore I identify with some of the issues from them. Were you able to get help for your partner, through GP? Were you able to get them engaged with that? Was that an difficult task?
That's not my responsibility. It's his responsibility to want to get well.
Yes.
And so, for me, I had to focus on myself and what I call my own recovery, because I feel I am in recovery. I have been harmed. I have been affected. And so, therefore, my recovery actually started prior to his. I actually reached out help for myself, despite whether he was engaging in recovery or not. So, I am powerless over his addiction. That's his journey and not mine. If we can be on it together, then that's great, and we can support each other through that. It's not always happens. Most of the women that I'm supporting currently, their partners are still actively gambling. So that's a whole different ball game. But in regards of going to the GP, no, he didn't. Not that I'm aware of, anyway.
Okay, well, thank you. And we'll pick up some of the issues that you raised right in later discussions.
Thank you.
And Colin?
Thank you. Hi everybody. A bit like Dean mentioned, I'll try and keep this a relatively condensed version of my experience of gambling harm, because I think all of us can probably talk for the full session if we were given the space to. So yeah, feel free to ask any questions, or if you want me to go into any detail on any more parts of this. So I started gambling in my late teens. As I was growing up, I had fairly normal childhood, if that makes sense. It was normal to me anyway. So some exposure to gambling, a bit like Dean, sort of in the arcades at the seaside. I was probably a bit more fixated on the opportunities to win money than probably was normal at that age. But I didn't feel I grew up surrounded by gambling harm. But gambling was certainly normalised, as it is in wider society. But I was always intrigued by it. And as I got a little bit older, went to university, started working, the time I had, the freedom, the opportunity to gamble increased, access to money increased, and started to gamble problematically. Or looking back now, I didn't see it that way at the time. Looking back now, I think I had an issue with gambling from a pretty young age, probably late teens, early 20s, but didn't do anything about it for quite a long time. It continued to escalate through sort of early work and early career, and my gambling was in person initially on sports, but then transitioned to online and beyond just sports gambling. It'd be initially a bit like Tom mentioned, it might be sports I knew something about. I thought I knew a lot about football or different sports, but then it'd go to horses or dogs or anything that I didn't know, sports I didn't know anything about. And then online, it'd go to online casino, online slots. We see how big that is as a market these days. That's grown hugely over recent years. And it's a real rabbit hole. I think I used to spend hours and hours gambling, but I didn't realise. I don't know if you've ever been on your phone looking on social media for 10 minutes and it turns into an hour. Imagine you're spinning reels or spinning a wheel every 10 seconds, 20 seconds, 30 seconds. That adds up very quickly, and the harm really can escalate. It did for me. My gambling was always hidden. So at the time, I never saw it as a problem. I didn't think I had an issue with gambling. But I never told anybody about it. I never showed it. People knew that I liked to bet a little bit, but I always hid the scale of it, which shows that deep down, I clearly knew that it wasn't right. And that's the guilt and the shame and the stigma. I couldn't see it at the time. It's only now I look back and think that's why I hid it. Because it's not right, it's not normal. I talk to my kids now and encourage them to be completely open and tell me what's going on, because I know where it can take you. In my late 20s, I had my own business. So I did a management buyout, had a business with 2 other people, 20 staff working for us, pretty successful to the outside world. That gave me more time, more freedom and opportunity. I didn't have a boss, more money. To the outside world, I was really successful. I was married, started a family, had a nice house, nice cars, nice holidays, and I guess like a peacock in some ways, sort of wanted the world to see how successful I was. And but the reality, I was a really different person. A lot of that success, or a lot of that lifestyle, was built on debt, on loans, on credit cards, on overdrafts. And I know the world's changed. You can no longer gamble on credit cards, but very much you can still live on credit cards. I don't think that stops the issue. Started to take money from the business to fund my gambling, because I was getting more and more desperate to continue, and in the belief, I guess, that a big win would come and sort it all out. There's never a win big enough. My mental health was suffering, even though I didn't see it at the time. My self-care was not great. It wasn't really sleeping. So it's hard to see it, I think, when you're in the midst of the addiction of experiencing gambling harm. I don't think it's really when I think I stopped and looked back with even only a little bit of hindsight, I could see that for a long period of time, I don't know how I survived, if I'm really honest. Missed like years of my kids growing up when they were younger. That's the bit I really regret, because the money side of things was significant, but I can't get the time back, and that's the bit that still stays with me now. And with money-wise, we don't always talk about numbers when we talk about gambling harm, because there isn't a threshold. It's always relative to somebody's circumstances. And I would never want there to be, like, you have to experience this much debt before you've got an issue with gambling. That isn't true. But we have to talk about our own experiences. For me, so on one of my online accounts, I had maybe 10, 15 online accounts. I staked over £900,000 in 1 month, in the last month of my gambling. I had multiple accounts and gambled in person every day, but I didn't think I had a problem. I thought I had a money problem. That I kept running out of it before I got that big win. That's a lot of money. By anybody's, nobody can afford to gamble that amount, and that's not normal behaviour. I was getting more and more desperate to keep those plates spinning, I suppose, or that, and like I said, I didn't really. There were moments of clarity. I'll come on to that later, perhaps later in the session. But I didn't see it. I thought I couldn't live a different way. I'd gambled for 15 years, 20 years. I didn't see that I could. To me, it was just my life. I didn't see there was a different way of living. I thought I couldn't see a life without gambling being part of it. I didn't know anybody else who. I thought I was the only person in the world that was living like that, going through that. I didn't know there were other people who had walked similar paths and now lived a different way and were in a better place. And yet it was still hidden. My wife would be married at the time for 7 years, 8 years, been together for like 15 years. I think she knew there was something, but didn't know what it was. Tracy, I don't know how common you find it, but she said like she thought I might have been having an affair or something like that because I was distracted, I wasn't there, I wasn't present. Yeah. In some ways, you see it, and I was, but just not with a person, with gambling. And everybody's different, but there's real commonality in a lot of stories. But it got to the point where it was just not sustainable anymore. That the lies were getting more and more extreme to try and cover up the gambling, and eventually those sort of plates that I'd been spinning started to fall, and I got to the point where I had to had a few choices. I suppose it's either to reach out and seek support, keep lying, make up some other ridiculous claims to try and continue to gamble, or to take myself out of the equation. And Tom spoke earlier about gambling related suicide and how common that is, and I think it's underreported, if I'm honest. I think there are more than that, just from people I know, and how much of it we've seen. So yeah, I'm still here, and I'm in a good place. So yeah, I'm grateful that I chose the option I did.
Look, Colin, thank you very much for sharing your, as I say, very powerful story. And also, you talked about this internal conflict, that you knew that you were doing something wrong or something was uncomfortable, and you had external life. Okay. When was that? What triggered you to get help? Right? What was that said, I think I now need help, right? Or I really have a problem? Because this has been going for many years, since you said your list late teens, rather, okay?
Yeah.
But you tolerated it for some time, but then something shifted right in your thinking. I wonder what that was, and what was that?
I think at times in my journey, I look at it a bit like a roller coaster, if you want to imagine it that way. There are some moments of clarity where there's a bit of calm on the roller coaster, and you think that's not as that I can't do that anymore. I shouldn't. That's not healthy. And I tried to stop by myself. I tried to reduce gambling by myself, or tried to cut it down. At times, I'd maybe exclude or put limits on one of those online accounts, like we talked about earlier, and think I can't do that. But then I'd convince myself a few days later that actually it wasn't as bad as it was. Or those had a lot of online accounts, so I used to get a lot of the emails and promotions and things from different operators. So yeah, there were moments of clarity along that journey, but I don't think I was. It never got bad enough that I thought I have to. If I don't tell I now have to tell my wife the truth. otherwise she's never going to. She wouldn't believe any more lies. And yeah, so I hadn't told anybody. I think the first person I told was my son, who was 1 at the time, on a beach in Wales, and I found it easier to talk to him because he was 1 and he didn't understand what I was saying. But that was like the first time the words had ever come out of my mouth that I had an issue with gambling, and talking to him around, like, not knowing what would happen next. I didn't know where I'd be a week later, whether I'd still be in the family, whether I'd still be in his life, whether I'd still be here. But starting to talk about it made it easier.
And what did you do about that after you talked to your son?
So after I spoke to him, I only told him that recently. Actually, he was quite proud. He's quite proud that he was the first person I told. He's 13 now. So after I told Charlie, I really took that window of opportunity, and really thought I need to commit to something. So I reached out for support, and talking therapy and group support worked for me. Through talking about it, I could unpick some of the things that were going on in my head. So in some ways, I look at gambling wasn't the problem. The gambling was how the problem manifested in me. In a different life, it could have been different. So I could unpick some of that and work on my own mental health. Through peer support and groups, I met other people who'd walked similar paths, and their stories were different to mine, but a lot of similarity. So I started to see that actually there is a different way, and put some abstention in my life, and quite quickly realised that my life is better without gambling being part of it.
Thank you for that. So obviously you had a point of insight, right, at some point. This is what I'm doing isn't right for me, at least, and I'm going to get some help. So there was some element of insight in yourself. Thank you for that. I'm going to ask my colleagues now to come in, and my first is Assembly Member Andrew Boff.
Thank you. When you first tried to access treatment, I wonder if you could tell us about that and how you get to that. Perhaps an epiphany, perhaps a point of decision where you realise there is an issue. Was it easy to access services? Did you know how to? Did you know where to go? And what was your experience, perhaps, Mr. Fleming?
So this would have been going back to 2017. Yeah, it was 2017. So I think I googled help gambling addiction, and although I can't remember it specifically, I remember not sort of coming out of that feeling particularly enlightened or empowered to get any help. So then I made an appointment with my doctor, and with my GP, and went to the GP and sort of explained everything that was happening, explained about the gambling. They didn't ask. I had to sort of bring that up, and I sort of listed all the symptoms that I was.
No, sorry, who is this to?
To my GP.
To your GP.
Yeah, and as a result, they put me on antidepressants. I do understand that the sort of focus on treatment here, but I don't think treatment is necessarily the answer to this, although it's clearly very important. I'm not saying otherwise. I don't think treatment is the answer to the crisis, I would say, that's caused by gambling at the minute, because I think we need to look, and I do understand that the sort of the realms of this session, but I think the point that I would make is that we need to look why do so many people need treatment. There was a study out last year that found up to 1.44 million adults harmed by gambling in the UK, and that's directly harmed. So as Tracy's testament to, for those people who are harmed, there'll be more other people harmed. I quoted earlier the Public Health England study from 2021 that was updated last year that estimated up to 496 gambling suicides a year. Just recently, in the last few days, there's been some more sort of stats that have come out that have shown that gambling profits, particularly online, are continuing to grow. We know that 86% of online gambling profits come from 5% of customers, those who are suffering harm. So those profits that are growing means more harm. I'm not sure if you saw the taxpayer list was published the other day, the highest taxpayers, and in the top 4 highest taxpayers in the UK Peter and Denise Coates of Bet365 and Fred and Peter Bone of Betfred. So they make up 2 of the top 4 highest taxpayers. GamStop, the tool that I mentioned earlier that I use to stop, their sign-ups increased last year. So everything is going up. So although treatment is clearly needed and there are a lot of people out there in need of treatment, I think that we need to look more at wider regulation and at the industry itself, essentially.
Can I just ask on that one, when you went to your GP, he prescribed antidepressants. Did he prescribe any other therapies or assistance? Was there anything, that was the only thing in the toolbox as far as he was concerned?
Correct, yeah. I was seeing a therapist at the time for something unrelated, so I think he recommended that I use that as a sort of avenue to explore things.
And without revealing anything confidential at the time, you did say to that GP, this is was it that you were depressed, or was that you had a gambling issue? If you don't want to answer that.
No, of course. So I went and I outlined the sort of problems that I was experiencing and how I was feeling, and the insomnia and anxiety and depression, etc. And then I brought up that this was, I didn't necessarily go and say I have a gambling problem, but I mentioned it, and they, the dots seemed clear as day there in hindsight to connect, but they certainly didn't at the time.
Right. Mr. Frost.
Yeah, so I'm not a man with data. I just with lived experience. So 20 years ago, it was just a straightforward phone call to Gamblers Anonymous, a helpline, and someone directed me to the closest meeting to where I lived or where I was working. So very fortunate in London, there's a meeting every night of the week, but there are parts of the UK where there is there is very few GA meetings.
How did you find them?
I can't remember.
I mean, can you remember? I mean, did you just know
probably
they
just
existed?
off the website, probably off a website. So yeah, that was my source of recovering and the support. I just got straight on the phone, but I do understand that there's the shame and embarrassment and the blockage. There's a lot of blockage to people that making that first effort to ring someone up or go on the internet or get into contact with there's plenty of charities out there providing support today, but what I would say is I noticed on the London Underground that AA's advertised, and I know it's down to AA maybe to approach London Underground to advertise, but there's not much in the way of posters or support for gambling charities, so it's something that I've recognised in the last few months on the Underground. So, but yeah, there's a blockage for some people whether they want to get support. But I was comfortable ringing up. That was my first port of call.
And if you don't mind, I'm going to skip to. I'll come back to you. I'm not. It's just your experience is quite different. Mr. Walsh, how did you know? How did you know what services, and what was your experience of those services? Because it sounds like Mr. Frost, actually, yours was a very positive one straight away as soon as you made that contact.
I think I was going to touch on this earlier. I think I did my own research to find it myself. I don't think education around gambling harm, certainly when I was at school, it was a different world to the one we live in today. I went to a good school, I was given a good academic education, but a very poor life education, if that makes sense. So I wasn't particularly sort of financially literate, mental health wasn't a thing that was discussed. And the world, it's a good thing the world has changed and evolved since then. But when I needed support, I went online. I found the helpline that was available. I also went to Gamblers Anonymous alongside Talking Therapy because, like I said, that was the peer support option that was available to me now. There are others available today that are funded, and it's a really good thing that they are, because having both that professional support to be able to unpack the things that were going on in my life, as well as support from other people that were outside of my family, and gave me that safe space was a good thing. And I needed it quickly as well. I think that's the thing I talked earlier about, sort of those moments of clarity. I needed that support then, Had I had to wait for it, I think it would have been a very different outcome. And it's something that I did want to talk about if given the opportunity, and my microphone's on, so I've got that opportunity really. I think going to the GP is interesting because not a lot of people do it. Certainly not a lot, if you look at the data, not a lot of people actually go to their GP currently to talk about gambling. And if people do go to the GP, I wondered if the chair might be able to answer my question actually. If I was to come to Dr. Zahoda and say I've got to present with some of the issues that we've talked about already, I'd likely get prescribed with antidepressants. If I started to talk about suicidal ideation, I might get signposted to talking therapy. How long would that take currently? Ballpark.
Access varies throughout London, okay, but I think we could get access within a couple of weeks to you through talking therapies.
I think it's interesting. I think certainly I know other people who've waited months, and had I had to wait that long, I wouldn't be.
So what was the first agency that you went to, if you don't mind?
So yeah, it was through the GamCare support network.
GamCare.
And I think, so yeah, that was the first agency, but that is the time to access as well that I think is amazing. And it's not really talked about, and it's where the third sector works brilliantly with the NHS. And we talk about a no wrong door approach. I think part of the issue is people don't even know what those doors are. It's not that there are many different. We all gamble in slightly different ways. We all recover in slightly different ways. So having multiple options of to find what is right for me is really important. And through the third sector now, if I was to call the helpline today, I'd be speaking to somebody in 2 days and be waiting less than a week to my first appointment. That's amazing, and that's why it's so important to tie all of this together, so that GPs know where to signpost to, or the organisations know where to signpost to. We don't have the conversation about gambling because people don't know what to do. There is support out there, and yes, it needs more funding. It needs sustainable funding. But also we need to raise awareness, and I think that's the bit Tom was talking about. I think that there are two things to this. There is a sort of societal change is needed in how we look at gambling, how we talk about gambling. But we also need to support the people who are impacted as well and ensure that treatment isn't forgotten. I think the societal piece is the longer term, but people are calling the helpline today. People are reaching out today. So I am a bit of a data geek as well, actually, Dean, sorry. But I did a data request before coming here. In Q3 of this financial year, so October to December, there was an increase of 20% in people accessing support in Greater London. So year on year. So that's increased 20% from last year to this year. That's a significant change. There's a press release out yesterday. People calling the helpline has increased 39%. I think that was in December. I think the awareness we're raising is seeing people start to reach out for support.
It's always difficult, isn't it, at times like this when the services become more apparent as to know whether or not there is an increase or actually the people who are already there are suddenly have that service available and therefore you get the increase. So time will tell. Ms. O'Shaughnessy, your experience is slightly different. How did you know where to go? What was your first experience of the support?
Again, there wasn't anything for me. And today still I hear stories of women or affected others that feel that, as I said earlier, they hit some sort of crisis point. And that can be suicidal thoughts. I've been that person where I didn't see any way out for myself. So for me, I came into it from a substance misuse pathway, to be fair, because that's what I knew. I thought I'll reach out and see if somebody can help me through that pathway, because I was so isolated. I didn't know anybody else like me. There was no one to talk to. There was nothing. I couldn't find anything. So through going through NA, I then obviously found GA. But the thought of going to a Family Anonymous group and walking into a room full of
Do you mind
people.
NA?
Yes, Narcotics Anonymous.
It is, thank you.
So it was very challenging for me. Also, obviously, childcare is an issue. I still have that now with women who struggle to come to groups and get support because of childcare. Again, there can often be domestic abuse issues that I've had women attend meetings sitting in their car for fear of their partner finding out that they're reaching out for help. So for me, it took a long time. I tried GP, as I said earlier, obviously Google, and then eventually I found someone on social media who had an Instagram account, and I messaged him and said, I need help because I'm in a really bad way. He was actually a gambler, not an affected other, and he pointed me in the direction of GamFam, who...
So just to be clear in my mind, so you through NA, that dealt with some of the
Yeah.
symptoms of substance abuse.
Yeah, but not with gambling.
But not with
so
gambling.
there was no support there for me.
Right.
Nothing.
And
So they put me in touch with GA.
right.
And again, I got a leaflet because there wasn't a meeting in my area.
And what was your experience with the GP?
With my GP or with GA?
Actually, I think you alluded to it earlier. It was just
GP,
antidepressants.
basically antidepressants,
Yeah.
followed by antipsychotics for PTSD, followed by I don't have any gambling harm training, so I can't help you.
So it was the story of somebody on Instagram that alerted you.
Yes.
Somebody else on Instagram.
Yeah, who was actually a
was
gambler,
worried.
so I reached out to him, and he put me in touch with the charity GamFam that do peer support groups for affected others, and that was like, I can't begin to tell you, completely changed my life.
Can I just ask? I've got a feeling you're all going to answer this. Do you think the current provision of support and treatment services for people suffering gambling harms in London is sufficient? Bearing in mind you're probably going to say no. How can they be improved? Actually, Mr. Frost, your response was actually sounded. Yours was the most positive, as far as I could see, experience of seeking assistance and getting it fairly straight away.
Yeah, for London, I mean, obviously, there's more meetings in London than any other part of the country. So, for Londoners, it's just probably breaking down the stigma or the shame that just making that phone call for many people. So, for GA, there's support. There's plenty. I mean, I think is there 14 charities in this space right now that are, mostly are funded by the industry. So there is support, but there may be. I don't really see many adverts or many. You've just got to go on Google and find a charity or a support network, and it's then down to that person to reach out. But that's. I've got no experience of doctors because I never went to the doctor. All I can say right now is there's 15 NHS gambling clinics, and the feedback we're getting is that maybe the length of time that people are waiting to get support is too long. So with the likes of Gamblers Anonymous or GamFam, we run 3 meetings a week. So the most someone will have to wait is 48 hours to get to a meeting. They can actually get most of the people get a phone call with me straight away if they ring me, and I can answer there and then. So with GamFam, they can get support straight away. The problem with the NHS, and it's not a criticism, but it's just a fact that it's 2, 3, 4 weeks before doctor, consultant to see someone that's going to put you in the right direction. In that space of time, someone could have lost 50,000, 100,000, maybe a relationship, maybe a job, maybe committed crime. So there is support out there. I think it's a big barrier with for the individual, the shame. But in London, there is support. It's just people have got to do their research. And the last bit I'd say is the common thing with GamFam. So I work for GamFam. Tracy works for GamFam. It tends to be the partners or the loved ones reaching out and not the gambler. That's a real common I don't know the stat on that, but it definitely more. It'd be far more than the gamblers. So it's the family members are the ones that really want the support, and the gamblers just maybe lagging behind a little bit before they're ready to hold their hands up and admit defeat. But it comes to the last bit. I'd say it's down to the pain of the individual. I've got to be in enough pain, or I've had enough emotional damage, physical damage, financial damage. I've got to say I've had enough. And that's all I'm going to say.
Yeah. Mr. Fleming, what's your view of the current level of support?
Excuse me. On a simple level, no, there's not enough treatment and support available. If we're talking about clinical support, as Dean mentioned, there's now 15, I believe, NHS gambling clinics in the UK, and obviously London was home to the first. But, and small caveat here, that obviously, as we sort of covered in our written submissions to the consultation, data can be sort of difficult and hard to extrapolate and potentially unreliable. But if you look at the potential treatment pool of London, which could be around 200,000 people, then clearly there's not enough support, and that would be 200,000 people experiencing gambling harm, so clearly not everybody there would need treatment, because there are varying levels within that. But there's simply one clinic isn't enough to treat all those people. So no, there isn't enough.
The government's proposed a statutory levy.
Correct.
That will increase the level of funding available. How do you think that will have a substantial effect?
Yeah, we hope it will. I think that will bring in funding of around £100 million a year, which is clearly a welcome step. But it's if you think about what you're sort of up against in the gambling industry and the potential treatment pool, it could do with improving. Certainly, it's not. It's a lot of money, but it's not a huge amount of money when you're talking about a national rollout of sort of clinics and treatment and research, and education also falls under that, I believe.
Mr. Walsh, this extra amount of money that may be available, how do you think that should be spent if it's?
Well, that's a big question. Can I go back to London? Can I go back to the last one in London first?
Yes,
so
please.
I am. Thank you. I work at GamCare, who are part of the National Gambling Support Network, which is a 10. If you split the GB up into 10 regions, the NGSN provides support across GB. Part of my remit is to advocate for the people, for anybody with lived experience. To hear, we've heard 4 different stories today from 4 different people. So I'm not there to talk about just my experience. It'd be wrong to do that, but it's to give a platform to the people who access support and ensure that our services are across the GB and specifically in London are developed based on people's real experiences and accessible. So I work alongside the team that deliver support across Greater London and make sure that's on the helpline that's 24/7, and people who deliver support every day by video calls, by phone calls, or in person in our office in Farringdon or in the community in Haringey. I think in the first of these sessions there was some discussion around the great work that's been done in Haringey. I know there's a new project in Westminster, in Wandsworth. There is, we've got a partnership with NatWest where support, because one of the issues across Greater London is just the cost of having a space. So if we wanted to deliver support to some in person anywhere, that costs a lot of money to do that. So we've got a partnership with NatWest that I don't think is talked about a lot, but it is a thing. NatWest let us use their spaces. I think if that could be done on a broader scale, that'd be it makes services a lot more accessible. But there's also then the education and awareness that these services are there and are available, and it's free and it's available to anybody. It's not just for people who gamble. It's for people impacted by the gambling. By other people's gambling. It is for family, for friends, and we also link up to. You talked about GamStop and GamBan. We can get those tools to help people, give people that life jacket, I suppose, when they're drowning. With a lot of that is financial. That's how the gambling comes out. But we can't wave a magic wand and make it go away. But we link in with Step Change or Pay Plan, or I think it's the right thing to do to get people as much support as available. I think we need to keep working on that collaboration as a sector. Dean, you talked about the number of organisations in this space. Ultimately, all of those organisations want the same thing, which is to support people impacted by gambling harm. We go about it in different ways. That's normal. And again, that no wrong door approach means that people need different things. Some people need to talk to somebody to work it out one-to-one. Some people need to go to a meeting and talk it through in a group space. Some people don't want to talk to anybody. They want to block gambling on their phone and block access to accounts. That's perfectly normal. But I think just awareness of what these things are doesn't exist. I think we probably all live in a little bubble where we think everybody knows about these things. Yes. When I talked to somebody on a train yesterday, or on a tube, or in a cab, it's amazing how many people know somebody who's impacted by gambling, but they don't know what's out there for support.
Mr. Frost alluded to earlier about advertising. I'm not aware of any. Is that something you feel could help?
In terms of advertising and awareness?
An awareness of the problem. I mean... Oh, of course we are. Yeah, I apologise. I saw this question. I thought I'm in danger of treading onto the next one, so I apologise for that. In which case, because awareness is it sort of moves into the next question. What do you think of? I mean, you've almost answered this, so it's almost a redundant question. Do you think GPs are trained enough to deal with this? I mean, I'm kind of guessing you're going to say no because of your experiences.
Absolutely not. And I think it needs to. It's a bit of a. And I suppose it's a bit like that with the NHS, that it's a bit of a postcode lottery. And I think really what needs to happen, not just with GPs, but with other organisations across London, the police especially, that needs to be looked at. That blanket training and awareness needs to be given right across the board, right across, because, you know, to a degree, it's endangering people's lives not having this knowledge. When a woman goes to a GP and, you know, is really unwell mentally, emotionally, physically, there's fear and violence at home on occasions, you know, to be told, I don't really know. I've got nothing really to offer you. You come away thinking, I'm really on my own here. I'm really on my own. You know, and again with the police, I had an occasion, unfortunately, 12 months ago where my partner had a little lapse in his recovery and decided that he was going to take his own life. And so I had no choice but to phone the police. The police arrived, 3 lovely female officers arrived at 5 a.m. in the morning, 2 of them straight out of training, and not one of them had gambling harm train experience, not one of them. I had to explain what had happened, that he was in recovery for gambling. He had emailed somebody in his support group that he had made a plan to end his life that day, and they had no idea. So actually the answer is yes, there needs to be lots of awareness around it. There needs to be referrals. GPs need to know where to pinpoint affected others. They need to be able to say, you know, there is this, try this, because until I met and spoke to people like myself, I was in a bad place, and I deal with women all day, every day that are in that space, and it's really harmful. You know, women are fearful of losing their children, their homes. They're stigmatised by their own families, judged. You know, why are you still there? Why have you not left? Why are you doing this? So actually, no is the answer. There needs to be a lot more training and awareness with all, like I say, even within social housing, with all sectors. There needs to be social services. I've come across that recently. I spoke to a social worker on behalf of somebody that I'm supporting. She had no idea around gambling harm. I won't even start about probation and prison, because we'll be here till next week. We'll have to do another whole meeting. But it's, I mean, seriously, it's beyond ridiculous. Where I'll just touch on this, that I was supporting somebody recently whose partner had committed a crime, and the judge asked a question regarding gambling harm, and the probation officer had no idea. The judge locked eyes with me. I nodded to sort of say, yeah, and so the judge actually asked the probation officer to come over and ask me the question. If I wasn't there, you know, this has got to really be looked at right across the board.
Thank you very much. And yeah, I'll hand back, because actually what you'll be doing, Caroline, is continuing on the line of questioning.
Okay,
Thank you.
and before you, I'm seeing the three themes here. Okay, one is, of course, they are related to each other, but there's people who have gambling problems, who have insight, and they go and seek help themselves. Then there's another group who have a gambling problem, but they don't have an insight into that. And then they're affected ones, they're their partners and their families, right? Okay? And so there's three separate populations that are existing there. And different helps. I mean, the ones who say, I have a problem and I need help, I think they're on a much easier pathway, because, I mean, if you realize I have a problem, you will take some action to do something about it. But I think the challenge becomes for the NHS, and certainly for me sitting here as a doctor, right, is that the people who are affected, when they come and see me, how do I help them, right? When the person who may be a cause of their problem are not in the room and aren't prepared to come to terms with that realization. That's a real challenge for me and for the services. Okay, but anyway, I just put that out as observation. Okay, and over to you, Assembly Member Russell.
Thank you, and thank you all of you for your testimony. It has been incredibly powerful, and I feel like I'm learning a lot. I think we're all learning a lot from what you're sharing with us, so I'm hugely grateful. Now, yes, sort of thinking about the advertising of gambling products and public health information. Dean, you talked about how AA are advertised on the underground, but there doesn't seem to be any gambling support. Tracy, you've just described the absolute lack of information amongst so many different agencies around particularly affected, you know, the harm for affected others, and the need for more information, you know, from the police, probation officers, housing support, all those different areas. Colin, you talked about the sort of the normalisation of gambling in childhood, you know, the kind of seaside arcades, and actually that's kind of part of, you know, it's a sort of tiny little thing that seems quite harmless, bit of seaside fun, but actually that is like the sort of the tail end of something that is much bigger and very much more addictive and harmful. And Tom, you talked about football. And, you know, football kind of healthy thing, you know, watch a football match, support a team, and yet there's this gambling that is absolutely kind of integral to the whole culture around football, stuff on the shirts, kind of, you know, just kind of, it's sort of like this very harmful thing that is wrapped up in something that could just be about supporting your local team. So you've all given really clear sort of evidence about sort of how gambling is so present in can be so present in people's lives, and the lack of information. So my sort of first and opening question is, what role do you think that the advertising of gambling products has in encouraging people to gamble and potentially experience gambling-related harms? I'm going to start with you, Tracy.
I think advertising is very impactful. From a mother's point of view, I know that I've had many women who have been impacted by gambling harm that are mothers, you know, come up against the issue of wanting to buy their child a football kit, Why would you want to buy your child a football kit that's got gambling advertising on it when, you know, their parent is a gambler and they can't afford to put food on the table? I was actually sharing with my colleagues previously that I have a 5-year-old granddaughter who came to me the other day because she wanted to play a game that she'd seen, and she described it as being pink and bubbly, Nanny, you know the one. I didn't know, and then I realised actually it was a bingo advert that she'd seen on the television, and my heart sank. I'm aware of how much advertising there is on trains and buses. As you know, many of our children are encouraged to get themselves to school on London Transport. And I just feel personally that, you know, it starts at a young age. We've heard these amazing people here talking about, you know, arcades and seaside trips with parents, and it just becomes normalised.
Mm-hmm.
You know, it's just becomes part of childhood.
Mm-hmm.
And that's dangerous because, you know, there's games, children have access to things 24/7, they're playing games on their phone, and lo and behold, suddenly an advert comes up, you can buy coins or you can buy something, and it's that gateway in. It's very impactful.
Yeah.
And from an affected others, you know, it's really triggering. I find it really triggering. If I'm watching sport with my partner or whatever, I find it triggering. You know, if an advert comes on, I automatically think, oh God, is he feeling like, you know, it's that anxiety constantly that we can't just sit down and enjoy something as a family.
Yeah.
You know, so I think just you know, I mean, I don't know about you guys, but, you know, if I see an advert for a nice skin cream, I'm going to want it. So it's like advertising's there because it's enticing us to buy something.
Yeah.
You know, that's what it's there for. They know what they're doing.
Yeah.
And so, you know, it does impact affected others massively. It's very triggering. It's very traumatising. And also from a, you know, as I say, with children, if you're impacted yourself by gambling harm through your partner, your brother, your father, whatever, you know, it's really difficult. So I think that is something that really, really does need to be addressed massively.
Can I just say something? Because you just mentioned if you're impacted by the gambling of your father, your brother, your partner, do many women gamble? I mean, what are the stats? Because
Yes, well, actually, probably statistically, these guys they're better with the stats. But I do know that recently I took part in. Was invited up to Scotland as the only affected other that was invited to talk about the impacts of gambling harm, because they're about 8 years, I think they said their own. And the increase, particularly, there's not a lot of difference. Tom will probably know, but I think actually the statistics are not that different in regards of gamblers, but I believe that the statistics are much lower for women gamblers reaching out for help, because again, there's that stigma. As a mother, as a grandmother, as you know, it's a very different journey for a woman. It's a very different journey because we're expected to be, you know, kind of maternal and holding it all together and, you know, being the housewife and having a career and all of those things. And lo and behold, this is going on as well. And I know that for some of the women that I spoke to there particularly, and women that I've spoke to in the space, menopause is another big impact. You know, and that needs to be looked into. I've spoke to lots of women that turned to gambling during their menopause. Also during COVID, a lot of first-time mums were isolated.
Yeah.
You know, services were closed down. Mum and baby groups. You couldn't go and sit round your mums and hand the baby over. Yeah. So, you know, and these adverts that are, you know, we're the community, join the community. That was a big outreach and a big thing for a lot of women. I've spoken to a lot of women that's when their journey started.
Right.
So,
Thank you.
know, it's huge. Thank you for
really
asking that question, actually.
That's
Thank
really
you.
no, that's really helpful. Just going back to the sort of the initial question, Tom, do you want to add anything? And also, if you've got any actual stats on the women and men, that would also be useful.
I don't actually have any of that data to hand, but I could supply it afterwards. But just to Tracy's point, I'm sure you'll have all noticed the sort of recent uptick in gambling products that are specifically marketed at women. Tracy referenced the the game that was pink. Was it Pink and Bubbly? Yeah, like Foxy Bingo, these kind of things. So that gambling products are increasingly marketed at women. And I mentioned earlier that the charity I work for supports families that have lost loved ones to gambling-related suicide. We do support a mum who lost her daughter to gambling-related suicide, so this isn't a male-only problem. There is a split, although I can't provide any specifics off the top of my head. And just to a wider point about advertising, and in football, personally for me, football was huge. Just the complete... I mean, gambling's embedded in football, isn't it? I think there was a study out that found if you watch a televised game of Premier League football, you can see gambling logos 3,500 times, which is insanity, really. Like I mean, it's hard to get your head around, really, isn't it? It's on the shirt fronts, it's on the sleeves, it's on the advertising boards around the perimeter of the pitch. If you're watching a championship game, you're watching a Sky Bet championship game. If you're watching Stoke City, you're watching them play at the Bet365 stadium. And I know last year the Premier League did agree a voluntary front of shirt ban on gambling sponsors, but that actually isn't going to make a great deal of difference because most of the logos aren't on the front of the shirts. They're already beginning to shift to the sleeves and on the pitch side advertising. So I think that is huge. And also in my own experience, it perhaps wasn't a case of you see an advert and you rush out and you put a bet on because you've seen that advert. Although perhaps when I was gambling and sort of self-excluding with some operators, maybe I would see a new operator and think, oh, I haven't got an account with them yet, I'm going to sign up. But I think the two problems for me with advertising is the framing of gambling and the problems that come from it as an individual responsibility issue. The health messaging, or the sort of so-called health messaging, should I say, that appear at the end of the adverts, the things like take time to stop, take time to think, sorry, and when the fun stops, stop. They frame it as something that you should be in control of, but these are addictive products. Can you imagine somebody saying that to someone who was in recovery or addicted to drugs or alcohol, or just stop, just don't have another drink, just don't take any more drugs? Oh yeah, hadn't thought of that. So yeah, that's a huge problem. I think all the adverts frame gambling as an individual responsibility problem, and I think to really understand that gambling harm come from gambling products, not people, I think is huge. And I think that realisation would be really useful for people before they sort of got to the point where they needed treatment, to my sort of earlier point. And I think also it just creates a sense of normalisation, just the fact that it's constantly there. And just to sort of draw on my own experience, having grown up around football, and then after 2005 when the Gambling Act opened the floodgates for advertising, just that surrounding me at that sort of point in my life, I just thought, this can't be something that can harm me because it's on TV all the time. So, and that really added to me blaming myself, essentially.
Yeah. And yes, the responsibility for the harm not sitting with the gambling providers.
The people that design these products and push them and give you offers, and it's the source of gambling harm is gambling products and not people. Yeah.
Dean.
Right. I've got some stats, but I made the stats up last night. I didn't make them up, but we had a meeting. We had a meeting last night. We had 15 people in our group, so it's a self-help peer support group. We've been going for 3 years, and the first meeting we had one lady on it, and then she dropped away, and it was just purely men for the next 2.5 years. When I say 18 months, 2 years, last night we had 5 women on the group and 10 men. I asked them the question what their prominent gambling was. The men was generally sports betting. A couple did say they did online roulette and slots. All 5 women, it was bingo, online casino, on online slots. So probably referencing what Tracy and Thomas spoke about how the product's marketed to certain groups. Yeah. I've never thought about the advertising for me because it's probably I was lured in by the win. But as a cab driver, I always remember seeing adverts luring, like going, if you have a first goal scorer and Arsenal to win 3-0, you can, if you put a £10 on, you win X amount back. So they, £10 to win £200. You know, you think so. I actually probably did fall for some of that, you know, or get lured in by some of that, you know, in the windows.
Yeah.
But clearly now, I just want to bring up, it's nothing to do with gambling, but I think it's related. I think there's a greater issue as well, looking at app designers, the technology industry. So forget the gambling. We've got Facebook, Google, YouTube. If you mention the word gambling and you're watching your YouTube video, the likelihood you're going to get a gambling advert thrown up in between. So I remember watching Panorama in 2018. It was about whistleblowers in the Silicon Valley, talking about the dopamine hit that people get when they get likes or retweets, or they get some sort of response online. Facebook, it said, was built to be addictive to children. Yeah. Whistleblowers confess Facebook is like a slot machine. So, you know, just using Facebook alone, you know, they're not there. Who knows? They may be partnered up with gambling, but they're just Facebook alone. They want people to stay on their site. So that's clearly got to be, you know, what the gambling companies want. You know. So some of my experiences. I want to talk about my daughter. I think it's quite common. Young girls play Roblox, a game called Roblox, where you walk around your own house and you create a living room, and you know, my daughter go, "Can I have a fiver, Dad? Can I put some new clothes on my character?" And over a period of a year, build up their own house. So this is called Roblox. What we find is a lot of the young lads, the young boys, they will play a game called Fortnite. Within those two games, Fortnite has got a loot box, which feels like it creates a dopamine hit when someone wins maybe a new gun, a prize, or a number of points that goes onto their virtual score. So that taps into the dopamine hit. They get that rush, that like. And the girls, I noticed a number of years ago, my daughter was playing Roblox very innocently. She shows me she's got the Wheel of Fortune. I don't remember the TV show, the Wheel of Fortune. You turn your wheel around and you get 400 points, 500 points, or a new dress, or a new crown for your character. So I think a greater area to look at is the technology companies of, you know, I'm a cab driver. I know Shoreditch and Hoxton and Dalston, the creative part of London. What are they doing inside these buildings?
Yeah, and that's like a sort of an evolution of those seaside slot machines, which were a normal part of childhood, trip to the seaside. I remember playing those shove penny games and whatever at the seaside, and it was like sort of once a year kind of thing that you might sort of have, I don't know, 10p or whatever in 2p bits to use, but it's but yes. So you mean it's becoming because it's on all our phones. It's becoming
prepping the future consumers, the future.
Yeah.
I mean, I know a bit. I've got friends that work in the gambling industry, and they're profiling people. You know, the likelihood is the phones are profiling youngsters, working out what their likes are, what their interests are. You know, are they going to be addictive? Can we lure this one in later life?
Yeah.
I just want to. The final thing I want to share as a cab driver. Last week I picked someone up from a company called King, who were in Wardour Street. They've been bought out by Microsoft. I think they're the designers for Candy Crush. If I've got that wrong, I think I'm right. King.
I think so.
And he was telling me he's involved in the French and German market. They still sell the computer games in the box. The UK market doesn't sell them anymore. The UK market's not interested in that. French and German, so they still sell like a game in a box and somewhat. He was saying the main driver for many of these organisations is to get people in a game on their phone and continuously buy in the game. You know, whether you're buying some more credit for more games, or buying as I say, going back to Roblox, putting £5 into my daughter's account so she can buy a dress for her character. So the interest is how can they keep people in it? He said, we actually don't want to build these boxes and games. It's not very valuable for us. It's not cost effective. We want people to be, you know,
buying in the app.
In the app.
Yeah.
So what does that tap into? Anyway.
Thank you. That's a good sense of what's coming down the tracks as well. Colin, do you have anything extra to add just on that overall problem of the advertising, how harmful that.
Thanks, Colin.
you think that
A
is?
few things. I think the gaming and games link is an interesting one. I think the bulk of the profits these days in gambling operators comes from online slots. So there's a clear link from game mechanics to online slots to harm. I do have some of the data actually. So last year there were 52,000 calls to Helpline 2023. Around 30% of those were actually from women. And I don't have the breakdown of whether they were women who, when I say calls, that's calls and chats as well. I don't have the breakdown of whether they were seeking support for their own gambling or for other people. But also, so that sounds great. But at the same time, there's some probably not so great stats behind it as well. Like around 13% of people who are have got alcohol or substance misuse issues are seeking support. For gambling, that's below 5%. For women who are gambling, we think it's around 1%. I think there's also, we talked about sort of support groups and peer support groups. Talking from personal experience, I think women are less likely to walk into a mixed Gamblers Anonymous meeting. I think you probably find that, Tracy, from what you see, just because it's a generally male-dominated space and it's a difficult thing to do. So that's where I think the data, I don't know the numbers, but I think more women are likely to go to their GP, for example, than men, or more women are likely to call the helpline because it's a individual and can be a gender considered approach. So yeah, on sports, I agree with everything that's been said, so I don't think I need to say it again. I think all I would say on top of it is that sports people who've been impacted by gambling harm, there's been a high-profile case in London very recently, shouldn't be forced to endorse a gambling organisation in their work. That happened yesterday in the match, for example. And also, I think there should be probably an immediate ban on sort of non-UK regulated gambling operators advertising. If you watch a football match, you see some sort of very strange companies that you've probably never heard of or never seen. Usually they are international gambling or crypto type organisations. They advertise in the UK because gambling is illegal in their home country, but the Premier League is streamed all around the world. That shouldn't be allowed. We don't need that. I also wanted to talk about the TFL.
Oh, well, that was going to be my next question. So let me frame this up, because in our last meeting we discussed one of the levers that the Mayor has, which is adverts on Transport for London network. And we talked to Tom Coffey, who is one of the Mayor's health advisor, and he said that there was a bit of a problem because how do we define harmful gambling? And he said the GLA has asked the government and public health partners to develop a definition of harmful gambling. He emphasised, we're keen not to ban the advertising of all gambling, only harmful gambling. Now, from what we've been hearing today, it sounds like the idea of non-harmful gambling is probably a bit of an oxymoron. So I just, do you think it is possible to distinguish between harmful gambling advertising and non-harmful gambling advertising?
Do you want me to start?
Yeah, why don't you start, Colin, anyway, since you raised TFL?
I think it's fair to say that some gambling products are more harmful than others. We talked about a lot of profits coming from slots. People still experience harm from the lottery, which might be at the other end of the continuum, if you like. But I think it is when it's not the products that advertise, it's the organisations. So it's impossible to make a distinction there. I know there's been some research commissioned which was inconclusive, but we all see the harm that gambling can cause. That's why it was researched. It's why it was a manifesto pledge. And I think for me, where the public, and I think I'm fairly grounded, and these days anyway, I didn't used to be, but I've changed. But I think like people get frustrated when politicians make promises, or officials make promises that are just not delivered on. And I understand that sometimes you might not be able to deliver exactly what was promised on, but explain why, and then say we can't do all of this, but we're going to do something rather than nothing. This is my personal opinion rather than that of my employer, and I don't know if I've ever said it out loud before, so here we go. For me on TfL, if you can't ban advertising, charge a premium for it. Charge gambling operators or other organisations who are in industries that cause harm a premium, and with that premium, give space to other organisations like AA, like GA, other organisations that are represented here today, or who are representing like awareness campaigns or harm reduction, because it's expensive to advertise, and we all work for charities that are funded on pretty small budgets, certainly compared to the 14.2 billion gross gambling yield that the gambling industry makes every year.
So you mean they could charge double and give that equivalent advertising space to the
to awareness campaigns,
to the
support organisations in Greater London. I was on the Elizabeth line yesterday, and all the way down the escalator was a brand new gambling campaign that was the full length of that escalator.
Yeah.
It's not right. And everybody's seeing that. I think I think that's a way of really saying, well, we think you're doing harm, and I'm sure gambling operators will still pay it because they make a lot of money, and they want the customers.
But it would have to be that the advertising given to the awareness and support networks would need to be of an equivalent status and prominence.
For me, yes, and I think we also have started to see some of the operators that there's always some responsible or safer gambling messaging at the bottom of an advert, but that's still a gambling advert.
Yeah.
You see it with, it's not just gambling, you see it with alcohol, for example, where alcohol brands are advertising alcohol-free or 0%. That's still the alcohol brand advertising. I don't, whether it would work, I don't know, but I think it's a way that organisations like ours can really raise that awareness, because that's a big part of the issue.
And yes, and actually they need to pay even more than they pay for the advertising that they're buying, because they've got to pay for the development of the adverts for the products to provide support to people that are as grabby and as, you know, the bubbly pink and green advert that catch people's eye. I mean, there needs to be the same prominence of promotion to the support networks if you're going to say we're going to ignore the harm, but you've got to
as an idea,
pay all this extra.
That sounds amazing to me.
But in an ideal world, would you prefer to see the adverts just gone?
Yeah, if gambling, if it can deliver on that pledge, then great. If not, then take steps towards it. And say, here's an alternative.
Okay, let me hear from everyone else just briefly. Would you prefer to see adverts for gambling completely gone on TfL? And do you have views on this kind of halfway house option?
I think it'd be a good idea just to remove all advertising. There's enough advertising in this world, you know. You've only got to turn the TV on, scroll through your social media, turn on the radio. If you listen to TalkSport, well, even other radio stations are advertising gambling. So I think it just for me, just an appetite for change, an appetite for raising awareness about gambling addiction rather than promoting gambling. Mm-hmm. So a straightforward, it's black and white for me. No advertising, more raising awareness about the harms or the potential harms of gambling, and raising awareness.
Yeah, Tracy.
Yeah, same for me. To be fair, I just think, and this might sound a bit extreme, but it's like sort of, you know, you wouldn't advertise your local heroin dealer, would you? So it's, to me, for me as a person, it's impacted me the same. So, you know, I also think that there could be some issues around, obviously, not everybody takes money from the industry in this space. Mm-hmm. So if it's going to be, that's the case, then there are going to be organisations within this space that are not going to benefit from that because they don't benefit from industry-funded organisations. You know, so actually, I just think it should just be a straight ban. You know, we are evidence here, and we could give you even. You know, we could have 1,000 people outside here telling you their stories of how they've been harmed. So, what more evidence do you need?
Yeah.
So,
that's very powerful, Tracy. That's very powerful. Tom, did you want to add anything on this?
Yeah, actually, just to build on Tracy's point about not advertising heroin, some online slot and casino-style games have been found to have addiction and at-risk rates of 45%, which is higher than heroin. Again, that is fully referenced in our submission. So yeah, and that sort of actually builds on the point I was going to make and sort of made earlier about gambling harm coming from gambling products. So there's no such thing as a safe or harmless gambling operator because they're all selling products like these and they're all trying to essentially get people onto these. So you sign up for a football bet that you see an advert for on the tube, and within a week you've got free slots, free spins, because they want you to use these because they're available 24/7 and they're the most profitable and they're the most addictive. So I say get rid of them all.
Thank you. And then the other piece is going back to what Dr. Tom Coffey told us, which was, you know, it's not clear what's harmful and what's not harmful, and surely we've got to allow the non-harmful adverts. Do you think it would be, I mean, Tom, you just mentioned some research that you've submitted in your submission into the harm of advertising gambling, which I look forward to seeing that when that comes round to the committee members. Do you think it would be good for the Mayor to commission research into the impact of gambling advertising on the transport network, specifically in London?
It certainly couldn't hurt to have the data, but I think we're at a point where we don't really need any data and research. We know that advertising increases consumption. The gambling industry spends 1.5 billion a year on advertising. Obviously, that's not on TfL, but in the country as a whole, to increase consumption, and they're increasing consumption of a harmful product. So it's harmful. So yeah, I mean, So to answer your question, sort of, but also I think there's more than enough to act on. I don't think we need to commission. Yeah,
that's very, very clear. There is more than enough evidence for the Mayor to be able to take action. Chair, back to you.
Thank you. Yeah, Emma, did you want to come in?
Yes, please. Thank you. Thanks. I just wanted to build on that point quickly that Caroline was making around the harmful and unharmful, right? And I suppose what Tom Coffey was meaning by unharmful was maybe things like the People's Postcode Lottery, National Lottery, I would presume. Is it worthwhile to protect those adverts in order to continue having the conversation about harmful or unharmful? Or do you think just trying to answer that question is not necessary, really? And perhaps if you want to answer it quickly, but just to get your thoughts. Tom, you look ready, or Colin?
Yeah, just briefly. I mentioned that continuum earlier, but I think even if you look at the lottery, for example, the lottery is changing to a new provider, if that's the right word for it. But there's a scale within the lottery. There's the main draw, and there's also scratch cards. We see real issues with people. People struggle to, if people have got issues with scratch cards, it's difficult to ban yourself from the corner shop or Tesco or Sainsbury's or any other scratch card retailer. They're there at counters at petrol stations, etc. There are online instant wins that are closer to online gambling than they are to the lottery. So that's one organisation, but they offer a range of products. I heard Lord Foster spoke about this really recently at the Gamble Aware conference around how there is scope to still levy the lottery, even though it's not really being considered. He speaks really well on it.
So is there any point in trying to define harmful and unharmful?
I think we've got quite a skewed perspective, I suppose, haven't we? For me, it's difficult because the companies rarely advertise a product.
So Dean, were you reaching for your...
So on, what's the date? On Tuesday, I put it out to, I'm on a WhatsApp group of 120 gamblers, people in recovery or people that are still struggling, and I just done some control questions, what you gambled on, what was harmful, what wasn't. I'll be honest, it come back quite inconclusive because it was all over the place. In-play football, bingo, slots, casinos. So it's, for me, I can gamble on I'll gamble on anything. So once I'm in addiction, I gamble on anything. But the final thing I'd say was the common thing I'm getting back from people is and it's scientifically or with research that certain products are more enticing, more addictive than others, and designed to be addictive. So rather than maybe asking us, find out what are they designing to be addictive. And it's my point, what I said about Facebook. Let's go back to the designers. What are you designing? How are you designing, and who are you targeting, and are you trying to entrap people? Does that make sense?
To be clear, the Mayor's not pursuing the ban at the moment because there's not a clear definition on what's harmful and what's not harmful, and that's the reason for doing it, because then how do you judge what's not harmful and not harmful? So my question really is, the thing that's holding back a TfL advert ban of gambling is there's not a definition of harmful. Is it worthwhile to just not have a definition and pursue a gambling ad ban in
Yes.
totally? That's my question. If that would, just to be clear, that's where I'm kind of coming from. Or do you see any merit in trying to explain what is harmful and what's unharmful? Tracy.
No, I just think. I just think it should be a total ban. You don't need to spend more money and waste time on research. We are the research.
Yeah.
It's as simple as that, really. It's just, to me, it's just constantly moving the gateposts.
Thank you. That's kind of what I wanted to see your views on. Colin, you brought an interesting point around the premium for space. But to be clear, the Mayor has massive powers over the TfL estate and does give out free advertising each year. Now, we've asked this at a previous question. I don't want to ask the basic question is, do you think the Mayor should give free advertising to charities? Because I think the answer would be yes. But you can surprise me by saying no if you'd like. But what I'm more interested in that question is, if confirm that you think that is a good idea. But if there was that free advertising, I think, and Tom, you raised this point earlier, there's no point saying just stop, right? So what content would actually be helpful on that free advertising, not just something that says, please stop?
Yeah, I think you need independent public health messaging about the risks of gambling, which will be about things like products, the mental health risks, and there's actually other local authorities that have already done campaigns similar to this, the GMCA, so the Greater Manchester Combined Authority, and Yorkshire and Humber. They've run really effective citywide campaigns, public health messaging, which actually address the source of the problem, and they don't sort of continue that individual responsibility narrative, which is quite sort of harmful, as I've covered.
And do you think it's worth focusing more on these are the public harms? These are your personal harms, and this is the public healthy safety message, or this is the outreach, and this is where you should go, or there needs to be a moderate balance of both?
I think in an ideal world, it would be early intervention and prevention. But we don't live in an ideal world, so I think there does need to be a balance, because there are clearly a lot of people out there who need signposting to help. One of the projects actually that my charity's worked on and just completed is a sort of resource resource hub called Chapter 1, which is live at chapter-1.org, which is sort of a big a hub essentially of independent information, and it's got treatment on that. It's got training on there for GPs and for other professionals and intermediaries, like you mentioned, so they can spot the signs of gambling harm. So yeah, I think definitely something like Chapter 1 should be advertised.
And would free advertising be helpful? Just to be clear.
Yeah,
Okay.
Absolutely.
Thank you. That was all my questions, Chair, unless anyone wanted to add anything.
Can I jump in briefly? I assume the free advertising is something like Dean, you mentioned the odd AA poster. I doubt we'd get the sort of banner all the way down the Elizabeth line on rotation. If we don't, if that's given away for free, then yes, please.
I think that this committee could always try and argue for it. Whether the Mayor would be up for doing that is perhaps.
But yeah, I think that awareness. Go push for the ban, but I reckon if that can't happen, do something. Don't do nothing. And I think harm reduction campaigns, awareness campaigns, signposting as well, like the no wrong door thing. That people don't know where to go. Like list. There are 4 or 5 organisations we've talked about today. There are many others out there. And my last point is you've got the opportunity to sort of regionalise it across Greater London as well. Signposted really, we've talked about sort of national or fairly national organisations. There's some really good pockets of local work happening, like in Haringey. Signpost to that, because whilst we live in a world where everything's connected, a lot of things are online. We also live in the world that we see every day. So make it local, make it real. I was talking to, I don't want to take this on too weird a tangent from a licensing perspective, but I was talking to somebody last week who lives in Romford. I don't know if any of you know South Street in Romford, but he was saying that he stood on one spot the day before and he could see 6 places he could gamble from being stood in one spot.
Thank
4
you.
of them
I
were
used
bookmakers.
Yeah.
2 of them were AGC, so arcades essentially. Are they the kind of high streets that we want people to live in, that we want the next generation to grow up in? I don't think so. And that's despite all of the harm that we've talked about being online. It's all around us.
Thanks. And yeah, I used to work at the Moon and Stars in Romford, so know it very well.
Thank you. It's just on the theme of advertising, and probably more pertinent to Tom, because it's in relation to football directly. One of the sort of growing practices that we've seen is on podcasts or YouTube podcasts. There's one I watch quite regularly, Stick to Football, and it's obviously sponsored by Sky Bet. In terms of looking at how industry can combat maybe some of the online advertising on podcasts, and particularly around, the show is also almost inexplicably sponsored by a gambling company as well, on bits where you can't even skip the ads in between segments or before or after a show ends on YouTube. Is there more that industry can be doing with social media providers as well to look at advertising where it's inescapable?
I'm sure there is, yeah. And one of the things we as a charity have been calling for is a complete ban on all gambling advertising. And I think definitely football is a really sort of common route in. So there's certainly more, but I don't have the specifics to my mind other than a complete blanket ban.
Just on that, so celebrities or ex-football players have a huge influence and a huge reach as well. Is there any more sort of individuals can be doing to limit what they're doing, which is effectively promoting advertising?
Yeah, well, I think that there should be a ban on celebrity endorsements for gambling, and there were some guidelines brought in by the ASA the year before last, I believe, but that they turned out to be actually quite sort of murky, and they were sort of quite easy to get around, because I think they were sort of mainly focused on young people and celebrities or stars who might appeal to young people. So I believe there were that sort of vagueness in the rules created a bit of leeway, and I think you ended up with people like Harry Redknapp still advertising gambling because he doesn't appeal to young people, and perhaps even Peter Crouch, because their careers ended some time ago. So yeah, there needs to be much more stringent rules in place there that can't be got around so easily, because celebrity endorsement is huge, especially in football. Like you see, I know Jose Mourinho was doing it whilst he was still a manager, right? It's huge. Again, if you're growing up and you see one of the most respected managers of all time probably endorsing a product, you're going to think, wow, that's fine. So it really needs to be addressed, doesn't it?
Thanks. Tom, I know the stuff you did with Clive Tilsley at GWO was really interesting. I think I heard him speak a few times for you. So, but yeah, that story of he was somebody that he chose to step away from what he did as a presenter, not because he'd been impacted by gambling harm himself, but because he saw it was wrong. It just felt it wasn't the right thing to do. I don't know if you want to talk on that, but I thought it was really interesting.
Well, yeah, he approached actually one of our campaigns. We've got a campaign called The Big Step, which is the campaign to kick all gambling adverts out of football. And Clive Tildesley got in touch because, as you said, Colin, I think he was working for TalkSport at the time, and part of the commentator's duty there was to read out odds before the game, and he felt uncomfortable with it, so he got in touch with a colleague of mine, and then he's since met with the charity. He hosted an event for us at the Labour Party conference this year, and you can tell that he's really he's had a journey. So it's possible for people to see, have the expression I often use is have the curtains pulled open and see the full picture. So yeah, that's a good example. So thanks for.
Just a small detail. Did you say chapter1.com as a
Chapter1,
website?
so chapter and then -1.org.
Org. That's what I got it wrong. Thank you.
No problem.
Emma?
Thanks. So the next section of questioning is kind of around the actions that we want taken that we haven't really covered already. We'll go through a couple of the different kind of responsible authorities, but perhaps we'll start with the government. And I know Andrew mentioned earlier one of the kind of bits of the white paper bill, I don't know if anybody has any further comments on the actions taken, especially in relation to kind of more of these checks that are going to start happening and being triggered, and whether these are good steps, whether the limits are around the right kind of place, and what anybody on the panel thought about that. Colin?
Yeah, I don't mind starting. I think, I know certainly GamCare, where I work, has submitted a response on this already, but for me personally, the checks are meaningless until there is a single customer view. So if there's a limit on one account, there are no limits to how many accounts I can have. So the daily limits or weekly limits or monthly limits that are talked about are per account, not per person. And until there's a stage where that is possible, I don't see how they're going to have significant impact. They will stop perhaps the occasional. We hear, and it's one of my frustrations really. We hear the super extremes. I talked earlier about the kind of numbers that I gambled when I was gambling. That's the kind of thing we hear about, but that's not the bulk of the people who are experiencing harm. It's at lower levels, and people are just leading rubbish lives because they're gambling all their wages. That's one of them.
Just to say, and you can correct me here. My understanding was that this was kind of going to bring together the online gambling stakeholders, so that it would be more of a cross-platform sharing of that.
There's an ambition to move towards that's called single customer view. That the technology doesn't exist for that to happen currently.
Okay, so but there is an ambition though of the paper, isn't it? So where do we need to move to make that happen then?
As I understand it, that's still 4 or 5 years away from being a thing. It's not possible currently. I think there's a pilot that sits with GamStop, if I'm right. But it's not within the white paper to say this has to happen.
And is there anything that brings that 4 to 5 year wait closer? Is there anything that you're suggesting in terms of that single
customer view?
Customer view.
Yeah, I think it's not my field of expertise, but I guess a desire to do it from the operators, and collaboration across that sector. Generally, I'd hope they want to be better. We want harm to be reduced. So yeah, I think that needs to, until that exists from a technical perspective, harm, any limit is only operator specific. And even within operators, an operator, so reluctant to name one, but an operator might have 5 or 6 different brands. You can gamble up to that limit with each of those brands, as I understand it.
Okay.
And that doesn't account for in-person gambling on Romford High Street.
Okay.
South Street, sorry.
Thanks. I don't, maybe we have the wrong panel, but I am interested because I think this mandatory data sharing is a big part of the new bill, and I've got questions about you not thinking that's implementable, but I don't want to question you too much. I don't think it's you. That would be fair. But does anyone else want to say anything about the bill?
Yeah, it's not really my expertise. I'm generally someone that works with people that are right at the bottom, but a friend of mine works as an analysis guy on data, sits in at home, keeping an eye on betting. This is with horses and dogs and on sports betting, not online betting. He was telling me on Sunday that he can stop someone very quickly if he knows they're going to be a winner. They're going to be in profit in time, but allow someone that's going to win to continue. Sorry, say that again. Start again. So if they're going to be a winner, they're going to stop them. If you're going to be a potential loser, and he's got the data and sort of past experiences of others, he recognised that person will be a winner. He will cancel them out straight away. So if they was £10,000 down today, but he knew that in time that he's going to win, he would still block him, even though that person's given £10,000. And it's through certain anti-post betting, which is a bit deeper. But that's the power that one person can have. They can ban a potential future winner. But if you're going to give them money away, they allow you carrying on.
Right. So what do you think was missing from the bill or could be improved in the bill? Tom?
I think advertising was conspicuous by its absence. I think it was barely even touched upon. I think the Premier League's decision to have a voluntary ban, which isn't really a ban if it's voluntary, is it, from 2 years from now, was sort of lip service and possibly sort of jumping before you're pushed. Yeah, I think advertising was the biggest thing left out of the white paper.
Thanks. Yeah, I think voluntary ban sounds as much of an oxymoron as you can get to, doesn't it, really? Tracy, did you want to add anything to that?
There's not really anything for me to add to that, to be fair.
Okay. In terms of the Mayor of London and the ways in which he might be able to do more to help, I mean, we've obviously covered the TFO estate and advertising there. Is there anything else that you can think about, Dean?
Does he have the power to have a strong partnership with football clubs? Because if football clubs are happy to advertise gambling, is there a partnership that the same football clubs can raise awareness about the dangers and a very powerful message from football clubs? Is there any possibility that specifically the London clubs?
Yeah, well, obviously there's a really obvious partnership between the Olympic Stadium and West Ham and the convening powers the Mayor has, along with the LLDC. But those convening powers, I think, probably stretch to all kind of London Premier League and Championship clubs as well. And so that's not a direct power, but certainly a convening power, if that's what you're suggesting, and something that I think would make a good recommendation.
And as a London cab driver, I know a little bit about Tufton Street and Old Queen Street, where the lobby groups are.
Yeah.
Who funds a lot of it? Looking at who has vested interests, as whether it be politicians, policymakers. I mean, there's people driving the industry to be more accessible to more people. So, looking at who funds and who drives the lobby groups, or who's behind the lobby groups.
Okay,
I drive around my cab. I'm aware of a lot of stuff.
The health committee.
Yeah.
The last bit I'd like to say as well, it's a different subject, but just spoke about COVID. So many people during COVID took up lots of addictions. According to CNN, 52% of addicts returned to their addiction during lockdowns. So moving forward, if there was ever another lockdown, God forbid, but would there be something put in place for people to give them support? And that's a report from CNN. Okay. That's another subject.
Yeah, no, perfect. Thanks. And so anyone else on the panel looking specifically at the Mayor of London and his remit? Tom? Yeah,
so just to stress that I think that there should be sort of citywide public health messaging campaigns, and also signposting healthcare professionals and intermediaries towards Chapter 1, where they can then train themselves on how to spot the signs of gambling disorder and refer to the appropriate place.
Thanks. Colin?
Thank you. I think for me, really, look at some of the best practices out there. Like in my notes, I've got some headlines of the work done in Haringey. So where they train and educate professionals from local public health services to identify and respond and support people who are impacted by gambling harm. Clarify and strengthen referral pathways to GamCare adult support services or other support services, not just GamCare. People might want residential support, people might want peer support, other services are out there. Raise visibility of support available, increase accessibility of face-to-face support by having those safe spaces that are in local communities. Increase collaboration between those local services and gather the data to evidence the impact of it. It's really good, and it should be done across London. I think the other one for me is signposting and recognition of gambling harm alongside alcohol and substance misuse. Generally, it's sort of people talk about sort of gambling harm being 20 or 30 years behind drug and alcohol services. That's not okay. Let's shorten that gap. So anywhere where, like, a lot of organisations have alcohol policies, have substance misuse policies, that very few have safer gambling policies, because people don't know what to do. They don't know. When I came in this building, which is really impressive, by the way, and I didn't know where the toilets were, and I was a bit nervous, so I wanted to find the toilet. I had to look for those signposts. Without that, I'd have just been wandering around aimlessly. So have that signposting to show people what that path can look like.
Yeah. I think Tracy, did you on this one?
I think, obviously, for me, just reiterating everything that everyone said, really, I would like to see, blanket training included with the police, London Metropolitan Police. I think there's a lot of work that needs to be done around that, to be fair. I think that's really important, because not just from the gambler's perspective, but obviously from an affected other. If you're in any sort of situation, whether it's, as I've touched on before, domestic abuse or mental health, or whether it is the gambler themselves, to then be confronted by an organisation that you're reaching out for help and they've got nothing to give. It's that's quite challenging. And again, just going back to what Tom said, across, healthcare, referrals, making sure that those support networks are there for affected others, focusing more on us. We're important, we're here. We're not an afterthought, right? We're not, and as well, we're here. It affects, they say on average, for every gambler, there's 6 affected others. I'd double that.
It's a lot more.
It's a lot more. It's wider. It affects everybody. It affects in-laws. It affects siblings. It affects children, and the list goes on. And that support's just not there. Women particularly. We want women-only spaces. Women find it incredibly difficult to reach out for help when they're possibly expected to go into a group meeting or whatever. With men, they may be having, coming from a domestic violence situation. We want that support. We want spaces for women, by women. And, as Colin rightly said, the difference between substance misuse support and signposting, I'm somebody that's come from both paths, unfortunately. It's huge. I can't even begin to tell you the difference. That I was really shocked when I reached out for help, because I didn't have those issues when I reached out for help as somebody affected by somebody's drug misuse. So, these are things, especially training across the board. I think the Mayor really, really needs to get up to speed with that.
I think it's a really important point you raise about the Met and the training, and to emphasise that at the end. Not least because of the situation that you explained earlier, but there's a number of violent incidents in betting shops and things like that, just to think if the police officers don't understand the addictions that might be fueling those, is quite remarkable, really. So it's a really important point you've raised.
Often women are treated by, and I know this from my own experience, I'm using my own lived experience, that I was actually cautioned and questioned when the police when they'd arrested my partner. And I was treated like I was complicit to his crime. Well, you must know. And and this is something that really impacted me, because, they then left with the party, because they didn't find whatever it was they were looking for. As they left me at sort of 6:30 in the morning, they left by saying, well, you do know he's got a gambling addiction. Well, what if I didn't? What if I didn't? What if that was the first time I was finding out that my life was about to be turned upside down? There was no duty of care, just left me with that. And, you know, that's my own story, and I hear that repeated constantly from women that I support. You know, that where they're ringing up for help, there's been some violence or something's happened, and, you know, that support is just not there because they just go, well, I don't know. I mean, what's it about? I mean, so, you know, just what, he's took the money, or do you know what I mean? It's bigger than that. Don't minimise this. Don't do that, because it's really harmful. So I think, particularly for me, the training within the Metropolitan Police and services outside of that as well, as I've said, social services, domestic violence organisations that I speak to on a daily basis, still a lot of them do not have that gambling harm training. That really seriously needs to be looked at. So yeah, that's my bit. Thank you.
Yeah, thank you, Tracy.
Could I just finish off? Sorry. Also, I don't think anyone's mentioned it. I'm sure it's on all of our minds, but also going into schools, colleges and university. Over the last few years, I've met many people who've gone to university. Within the first few weeks, their grant's gone, or they don't even finish their degree. So I'm looking at education at an early age. It could be junior football clubs actually talking to parents, because a lot of the parents probably don't know what's going on the phone, you know, while their child's playing Roblox or Fortnite, that they don't realise that what's actually on that device, or what may be potentially luring them that later down the line. So maybe there could be a big education campaign in London or around the country about the raising awareness about the dangers of gambling and the harms that it can cause.
Yeah, because you're doing online safety now in schools from reception, basically, and gambling is part of that online safety.
Well, I'm old enough to remember when we got taught across the road, but but now it's, you know, stuff, you know, I never had that in 1989. You know, giving me age away now.
Of course. Colin, did you want to say something?
Yeah, just one more from me, and it builds on Tracy's point as well. Is really engage with people with lived experience of harm. Because hear those stories, and that's what makes it real. Like, we talk a lot about data and stats, and I've had a few numbers written down, but each one of those numbers is somebody's life, and is their family's life, and their partners, and their kids, or their parents. Hear some of those stories from people across London who've been impacted, and that is what makes it real. That's the things people remember.
So in terms of putting that into a recommendation, would that be for the Mayor of London to have some sort of forum, summit kind of event where you're...
Yeah, that is just hearing those stories from people, and not hearing the organisations in this space who all do different things, but hear from the people who've had support from these organisations. Hear how valuable it is. The work that we do, that all of us do, it saves lives, it changes lives, and it sometimes has to pick up the pieces for those people left behind, which is really sad. So let's not let it get that far, or let's do our best to not let it get that far.
And the one final question I had is the one where, as a committee, we've clearly have the most limited powers, but we could still make recommendations, is in terms of the gambling industry. And, I mean, a stop existing might be your recommendation, but is there anything anything that you could specifically think that we could be asking or lobbying from the Assembly through this work?
Yeah, they definitely shouldn't stop existing, in my opinion anyway. I think they just need to essentially clean up their act, to use a better phrase. They make the majority of their profits from harm. That needs to change, and this harm doesn't happen by accident. It happens because of their products, because of their practices, things like marketing, misleading offers, things like cross-selling, things like that. So they need to stop that. But unfortunately, for them, that would mean essentially a hit to their bottom line, because they make most of their profit from harm. But that needs to stop. But obviously, that will get a lot of kickback because they're private businesses whose aim is to make money.
Could you, sorry, briefly describe cross-selling for me?
Yeah, sure. So cross-selling would be where say I'm on the train on the way back today and I see an advert that says sign up with X and X and get a £5 free bet when you put £10 on. So then I'm in there. I'm in because I'm a football bettor and I'm with that gambling operator, and then they start to cross-sell you towards different products. So they might be sending you offers to get you in, for example, for things like online casinos, online slot games. So they've essentially converted a sports bettor to an online casino bettor, which is the most sort of dangerous and addictive products. So it's a very common sort of route in that I talk to people about, that they come in through football because it's the sort of hook that gets people in, and then once they're in and that they've got the data and they're profiling you and they're profiling your age and your characteristics and things, they'll push you across to the more addictive and dangerous products.
Thanks. Did anyone have any other specific kind of recommendations or things we should take on board of the gambling industry and things they could do too, as Tom said, clean up their act?
For me, I guess less industry specific, but more awareness. Don't stop learning about what else is out there and what support is out there and the organisations. I know GamStop were mentioned earlier. We're at GamCare, we run a partnership called Talk Ban Stop, which is with GamCare, GamStop, GamBan. We're hosting an event at the House of Lords on the 28th of February where Lord Foster's speaking at that. I'm sure I can get you guys on the invite list if you wanted to come along, or any of you guys if you want to come along. It's great to just engage with the organisations and find out why they exist and how they come together to support people. Because I think I agree with Tom that campaigning against the gambling industry, I don't think has an end goal that we can achieve. But what we need to do is just make them be better and ensure that fewer people are harmed. And those that are given the best support.
Is there one perhaps thing that one online provider, betting shop has done that is kind of best in field that everybody else should do? No? Okay.
That's a big question. Yeah, that one operator, the seatbelt has never been invented for gambling. Well, unfortunately, if it was, then would they share it? They probably should. That doesn't exist. So, no. Practices are very slowly changing. But technology is also quite quickly changing. Yeah. So yeah, that sort of seatbelt that saves millions of lives a year doesn't exist in gambling, for me.
Thanks.
Assembly Member Hirani.
Thank you. I think it might have been Tom in one of the earlier exchanges that mentioned the Gambling Act, and I think, Colin, you mentioned licensing laws as well. Do you feel that it's time that legislation was reviewed?
Well, it just has been reviewed, the Gambling Act. It was reviewed and the white paper was published in April of last year. And a lot of the things, obviously there was the reform side and the industry side. So a lot of the things that were included ended up being a little bit watered down, and a lot of the actual nuts and bolts and the details went out to consultations, which are undergoing and yet to be announced. So although no actual reforms I think I'm right in saying that, Colin, no actual reforms have been enacted yet, the review itself, the Gambling Act, has been reviewed.
So last week, a couple of cabinet members from Brent Council in my area wrote to the government just explaining about the harms of operators on high streets in the borough of Brent, and calling for more powers for local councils to make decisions that are right for local communities. Is that something that you would like to see? I think, Dean, you alluded to some of the newer types of betting shops, so the slot machine shops and gaming shops that are popping up on high streets.
Yeah, so centrally in London, probably certain streets that I used to go and gamble, then betting shops have disappeared, but they've been replaced, or there's more online, slot machines and casino 24/7 sort of arcade type sort of premises. I forgot the question now.
Yeah, so do you feel that council should have more powers in controlling sort of what goes into high streets?
Without a doubt, because I'm sure it's, once again, the people that own or the betting shops or these organisations are targeting certain high streets because maybe knowing that people maybe have got less money and more needy, and so the likelihood is, without a doubt, councils, governments, whoever's making policies,
And just because it's not an area that I think we've discussed much in terms of the slot machine, arcade type shops, is there any, do any other panellists want to come in on any thoughts on those?
I know there was a YouGov survey last year, I think, that talked about people using betting offices, arcade slot centres as warm banks. And the number, I think it was one, top of my head, so don't quote me, though I'm conscious this is recorded in minutes. I think it was 1 in 8 who gamble harmfully have used those kinds of establishments as warm banks. That's horrific. And even in, there's also a big concentration. You see it on any high street in any part of London. A big concentration of gambling establishments in the more deprived areas. That tells you something in itself. You don't need the research to tell you why that happens, and it just doesn't feel right. I would also just add the protections that we've talked about today are getting better. It's things like GamStop and GamBan are great for online gambling. I think in person needs to go some way to catch up. The same technology, whilst there are national schemes, they're not quite as effective as the feedback that I get from other people. It's hard to stop yourself. If you think about gambling, what sort of that broader question of what is gambling, we're not just talking about betting on the horses or in a casino or an arcade. You add lottery, you add scratch cards, and those slot machines that might be the pubs. It's all around.
Just regarding the protection, I mean, not on the street, but online. This is another one that I've got live little polls from people in the recovery community. Or where is it? Did betting companies online or on site ever do affordability checks? Oh, so online and on site. Did they do any affordability checks on you or question your gambling? 9 said yes, 15 said no. So 15 have been allowed to continue to gamble, so let's say irresponsibly or without control.
Sorry, just to come back in one more that I meant to mention for me, that on the licensing side, it's not a world I fully understand, but I know the basics of the aim to permit scheme. I think, is that the right approach when it comes to high risk? We talk about high risk areas on TfL estate and advertising. The same principles can apply when it comes to bricks and mortar buildings that cause harm.
Assemblymember Russell.
Thank you. Yes, I've just got a few things I want to pick up on that sort of go back a little bit through. We've talked quite a lot about gender and, the different experience of men and women. I'm just wondering, in terms of London's a very diverse city. We've got huge numbers of different communities, and I just wondered, is this are there differences amongst different communities within London? Tracy?
Yeah, from an affected others perspective, definitely. What I have seen is a rise in women coming forward from the Muslim faith, and particularly within Islam, gambling is classed as haram. And so it's a very closed community. It's a huge cultural issue rather than actually a religious issue, if that makes sense. And so particularly we're trying to reach out to that community specifically, but it's very difficult for most of those women that I speak to. I spoke to one just yesterday at length, and I can touch on this because my daughter actually converted to Islam, so I understand her journey. And she just cried for about 10 minutes and said, "You're the first person that's actually heard me." because she went to a local mosque and she was told that she was bringing shame against her husband and that she must never speak about it again. So there is a huge issue here. There's a huge community of women that we're not reaching, particularly. And that's just one area that I'd like to focus on moving forward.
So that also points to having information about gambling on buses, tubes, places where people travel.
Absolutely. And I support another lady whose husband is, again, from the Muslim community, and he will not go for any help at all because of the shame and stigma attached to that. So, you know, because he's worried his family will find out, and he, you know, so that's just a couple of examples from both sides there. You know, but yeah, it is something, particularly within the organisations that I work with, that we are looking at ways at how to reach those women, particularly because it is something that I am really aware of. And how do we approach that safely?
Yeah. Well, and
delicately.
If we're already seeing, you know, we've heard about the barriers to seeking help anyway because of the shame and the stigma, which we heard about at the very beginning of this session. But then if you've got another overlay on top of that, then
absolutely. And I do find that women from those particular communities struggle even more. Yeah. You know, for example, a lady just recently, you know, that she can't reach out for help, and you know, she's really struggled with her mental health, and just cannot talk about it to anybody else. Yeah. And so, you know, looking at ways that, as you say, positive advertising and signposting is a way for these particular women to be able to go, that could be me, and using advertising that, you know, looks like them. Yeah. Do you know what I mean? But, you know, because
so culturally
it's
competent
relatable.
advertising.
Absolutely, it has to be relatable.
Yeah. Thank you. Okay, I've got a couple of other things I wanted to pick up on. Sorry, I'm just scribbling things down here. So we've talked a lot about the sort of development of online gambling. There's another online product which is cryptocurrency, and I just wonder if you're aware of evidence or experience of products and services that have financial risks that are similar to gambling, like cryptocurrency, and whether that's also influencing gambling behaviour. Is there anything that anyone wants to throw in on that? Tom, you look like you might have.
Yeah, I recall there was some news in the last year or so, wasn't there, Colin, about a rise in people seeking help for crypto-related issues. But I think it's just, I mean, in itself, cryptocurrency is just an asset, right? No matter how volatile or speculative it in itself is just there. But it's the way it's marketed, and again, there are clear parallels with gambling and the gamification of the apps and like the sort of checking all the time, and yeah, so there is a crossover, I think, but I think that's probably more in the marketing of the product as opposed to the product itself, if that makes sense.
Yes, I suppose I'm just thinking if we're talking about controls on marketing gambling, whether there should be additional controls that relate to products like cryptocurrency, whether there's kind of crossover into the gambling harm space.
Yeah, I've actually experienced a few more people in the last year joining our recovery community with crypto, like being involved in crypto. I worked during lockdown. There was no cab work, so I went and worked on a building site over in Slough with a lot of young builders, and a lot of them spent a lot of their time on their phone and asking them what the hell you like. It was either they was looking at their phone definitely after 1 o'clock, so they was either involved in the trading, the forex trading, and the American markets, but they was also heavily involved in crypto, and they couldn't stop looking at their phone whether their trades were going up and down. So, as far as I'm concerned, if there's an unhealthy relationship with I'm consumed by it or they're consumed by it and can't concentrate on their day, then crypto's a problem. And again, I use the example of people in the back of the cab. I asked the banker last week what he thought of crypto. He went, I don't even get involved. A nice big house, worked in the City of London. I assume he was doing well for himself. He went, if I don't understand the product, I don't get involved. But probably the likelihood is we've got lots of young people thinking that it can get rich quickly, and likely it's not going to happen.
Mm-hmm.
So as far as I'm concerned, I think crypto needs to be being put in with another form of gambling.
Colin, did you look like you were going to say
agree with
something?
that. I know people that we've supported at GamCare who've suffered harms through crypto trading because there's no specialist support exists. So they see the parallels and come to gambling support services. Crypto companies advertise those high returns, quick sort of short 24-hour high returns, which is essentially parallels to gambling, but it's also not regulated as gambling. So we're not strictly funded to do all this. Whether we should be is an entirely different question.
Yeah.
But I think anybody who's probably walked paths that we have can really see those parallels, and it's certainly not something I would ever consider doing because I see it very much as gambling myself.
Yeah, thank you. And then my final question, we heard just earlier, and I can't remember who it was who talked about it now, but we heard that there was some good practice in Haringey in terms of training people well and making sure that all the different agencies that might encounter someone experiencing gambling harm might come into contact with. So all the people that, Tracy, you've been mentioning around, contact with the police or with social workers or housing support. Are there any good examples of places where gambling advertising has already been removed or banned that hasn't been mentioned so far today? Is there anything that you're aware of that's sort of like tip-top good practice that London should be having a look at?
When you say place, how loosely are we drawing that term?
City, country, town, village.
I know there are countries that have banned gambling advertising in Europe, or certainly put severe restrictions on. Belgium, Spain, Italy, Norway have some form of restriction, and I do recall seeing, although I can't quote, the Norway example. After X amount of time of either banning or restricting, they saw sort of harm levels go down. I can try and dig that out and forward that over to someone because I appreciate that's quite vague.
That would be really helpful.
I'll make a note of that.
Because it's always good to tell the mayor to look to a particular place for examples of other practice.
Agree. I think we need to look outside of the UK for this, especially if you look at, there's a researcher in Bristol, Raphael, I'll call him, Rosso, who's great on social media and advertising. I've seen his presentations a few times. We have some of the most lax gambling advertising legislation in Europe.
Okay.
There's precedent for bans in sport. We wouldn't be the first to do this. There is some practice elsewhere. Thank you.
Thank you very much indeed. And back to you, Chair.
Thank you. Thank you to all members of the panel. And if you think of something, and particularly of the issues raised by my colleagues, if you can send the information to the Secretariat, it'll be very helpful, and we'll, of course, pick it up. Thank you very much for sharing your very personal experiences, and thank you to all the committee members for dealing with this matter so sensitively. So can we, I just got to finish off a few bits of formal business and then we will be free to go. Can we delegate authority to me as chair in consultation with the party group leads to agree any output from the discussions?
Agreed.
Can we note the committee work programme? The date of the next meeting of the committee is the 13th of March 2024 at 2 p.m. in the committee rooms 2 and 3 of City Hall. I have no urgent business. I therefore declare this meeting to be closed.
This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by.